So it's time now to move on to the next part of our time together this afternoon. We met Keris earlier, Keris Wynne-Davies from Pinsent Masons. Hello again, Keris.
Hello there.
Hello there. You're going to be speaking through the Goldacre review with us, yeah?
I am, and I'm going to keep it very brief so that we can get into the panel discussion as soon as possible. But I think the discussion around health data, the issues that we identified in the poll around the challenges in accessing data, the issue that Lara brought out around public trust in the use of their data, that discussion wouldn't be complete without looking at this report that has come out of the Goldacre review. So this is a review that was commissioned by the UK government back in February 2021. And Professor Ben Goldacre and the team that he gathered together went away and they interviewed over 300 people. They spoke to focus groups, they took submissions in and looked at those and have come back with a number of recommendations. So the challenge that they was put to them to try and come up with some solutions around it was how to improve the safety and security in the use of NHS data when used for research and analysis. And as we know, when we want to use AI for health purposes, then we're going to need to at least analyse the data and use it for those purposes. So it's a very key issue. And NHS data sets are hugely valuable in that process. In fact, the report starts off by recognising the massive value around it. And I'm going to read from this because I think it's a very passionate statement and it just shows what value is there. So 73 years of complete NHS patient records contain all the noise from millions of lifetimes. Perfect, subtle signals can be coaxed from this data, and these signals go far beyond mere academic curiosity. They represent deeply buried treasure that can help prevent suffering and death around the planet on a biblical scale. It's our collective duty to make this work. So it's a huge recognition that data is at the core of all good work in healthcare. We've seen the global response to COVID-19 being a huge driver to the use of AI, the use of research, and the key aspect that data plays in that. The interesting thing as well is that there's very much a nod not to perhaps just the research that is typically carried out around health data and the advances in treatments, but also there's a nod to the ability to develop whole new classes of medical technologies. So it's very much what we're here to be talking about. Sajid Javid, in his ministerial introduction, also recognised that health data has an additional concern around privacy. We have far more concerns about our health records being disclosed, so that's a very clear challenge. He also recognised the complexity in the NHS systems to enable people to access data, and that hasn't been unjustified because of that privacy concern. So what then are the recommendations? Well, the alarm bells are that there are 185, but the good news is I'm not going to talk about all of those. I think it's fair to sum it up as very much an infrastructure that is being proposed to address the key issues around security, privacy concerns, and just the trust from patients in what's being done with their data. And a very key implementation, Annabelle mentioned it earlier, the concept of data trust. So having a secure environment in which data can be accessed rather than it being shared liberally with many actors. So that is a very fundamental part to the recommendation, and a lot of the other recommendations come from that. So the idea would be to have a trusted research environment, or a number of those, but actually the recommendation is to keep the numbers small so that you can have that certainty around that particular environment. Effectively, the users, the researchers, would go to the environment rather than the data being sent to them. And within that environment, again, it's recognised raw data in itself is of little value. So it should be curated and managed, cleaned, reshaped, and prepared so it is more accessible when people access it. And through that, interestingly, there's very much a criticism of the pseudonymization route that has been taken, whereby the data is used with taking away names and addresses and other identifiers. And we certainly see in the health sector that can be a risk, because once we're into a rare disease area, the number of people involved can mean even stripping out some of that information can still lead to it being identifiable. So they see that as a weak security practice, something that is actually holding us back, where it's slowing up our ability to use the data, even when we've got permissioned use by ensuring that it is pseudonymized. It's seen that there isn't then the same confidence in using the data. And therefore, the idea of having these trusted environments instead is very much seen as something that will give far more public trust than the current systems that are there. Just then to mention some other aspects of it, as I say, they all build on to that original concept. The idea of having specialist data analytics services within the NHS to improve the resources, making sure that there's a promotion of the standards that are going to be used around it. So there's discussion about reproducible analytical pipelines, so best practices being adopted, but also a sharing. So not a sharing of the data itself, that's not going to be open, but all of the software that's developed, the codes that are developed to ensure this good curation of the data and its accessibility would be shared in a way that, again, it enabled people to use that data when they access it. So recognition, again, of training. We talked about this a bit earlier, making sure that they have the people that can do this. And also then looking at the final bit that I'll mention is governance. So we heard within the poll that your regulatory barriers are becoming a problem. Therefore, perhaps we put in place complex agreements to enable people to get the access that they want and need to advance healthcare. And rather than that, putting in place a system that was very carefully thought through, but we rationalise the approval process so that, again, we have certainty and ease, but also within that secure environment so that we have the assurance around security and safety. And then, interestingly, a frank public conversation is seen as being needed about the commercial use of NHS data. So, again, an element of transparency, but a logical recognition that this is a huge treasure that the NHS has, that there is a commercial value to it. This value should go back to the NHS, which in turn helps healthcare more broadly. Just finally saying on that, a very interesting way of looking at it, and I think they probably smiled when they added this to the report, but they say, build impatiently, but incrementally. So I think they realise that there's a real need for this. There's a real pressure to move forward. This is going to sit alongside the NHS data strategy, which we're looking forward to seeing in final form. But it's really something that we need to get on with to enable us to do the research, to create the AI tools that can in turn improve health. Thank you, Clive.
Thank you, Keris. Thanks for that insight into the Goldacre review. Any questions people have to further make the most of Keris's knowledge on this topic, do put them in chat. I'm sure we can ask Keris to check those out. And also, of course, always watch the chat for links to the various resources and information that we're discussing now. But for the meantime, thank you so much, Keris, for that insight. We're going to move on now to the final part of our time together this afternoon. We're going to invite back two of our guests to whom we spoke earlier. That's Maya Carlisle from the National Physical Laboratory and also Annabelle Richard from Pinsent Masons. Welcome back, both of you.
Hi. Good to be back.
What did you both make of Lara Groves' talk that we heard?
I thought that was super interesting.
Absolutely. I thought it was very good, sort of looking at, a particular area that I'm very interested in myself, which is within the AI of the data sets that feed in and whether they're inclusive and representative of the audience that they're trying to be applied to. So, yeah.
We'll actually be circulating Lara's talk along with other materials from this whole session to all attendees. So if anyone does want to watch that again and digest it again or share it with colleagues, do watch your emails because we'll be sharing that later. But I've got some questions here that I'm looking forward to offering to both of you. Some are focused more towards you, Maya, some you, Annabelle, but I'm very much up for hearing any thoughts that people have. And of course, your questions that everyone has in the wider room, do pitch those in chat. If you'd like to hear more of Annabelle's thoughts or Maya's thoughts. I'm going to pick on you first, Maya, if that's okay. The question I've got to ask you here, ICO and ATI guidance around explainability is practical and detailed, but how much context-specific explanation is required, and how can this be both comprehensive and user-friendly?
Yeah, and I think this is a really good point, because a lot of the areas we see where they're guiding in AI is about trying to protect us, but it doesn't necessarily always cover all the areas. I mean, we heard earlier on, just within the last talk, was looking at data sets themselves and trying to protect individual users that you can pull out. We had this in the past with things like within the AIDS crisis, where you could identify people in data sets and you could nominate who actually had it and extract them, and it's all part of hacking data. But we also see this potentially missed out in this within areas where we're trying to protect data sets, but where I don't think it goes into enough detail is in how to do that. So, for instance, you can encrypt your data set. You can also encrypt your algorithm, so I can share it freely. And we see this sort of in large sort of systems out there already, which are very capable of sharing data on larger scope. But I think also what we also need to help people understand is that also we end up with shadows inside the models. So you can start extracting other people's data out of their models. So they might think they've actually protected it, but they might not realize they're actually exposing the data set that they think is protected externally, but they're also missing out on opportunities where they can share their data, but they're not encrypting it correctly, or the algorithms to share.
Annabelle, do you have any thoughts on that one about the need for context-specific explanation, an explanation that is both comprehensive and user-friendly?
I think the word trust has been said a number of times today, and that's key. And to gain trust, it means that you need to be able to explain what you're doing, how you're going to do it, and of course, what type of security, as Maya was mentioning, what's being done to ensure that the data or the purpose is not infringed, that people are not going to do something else with the data than they've been explained. You need to be able to understand exactly what's going to be done by who, how, what level of protection you're going to be given, whether you're talking to professionals or to citizens, because a number of health professionals are themselves a little bit have reserves or a little bit concerned about the way their data or the data they collect about their patients or something else can be used. So I think these contextual explanation, detailed one, user-friendly, adapted to the audience are absolutely key to the development, of AI and the collection of useful data sets that can be shared,
Thanks. Now, Annabelle, we know earlier on from our time with you that you've got a particular specialism on the topic of data within Europe. Let me ask you, what are you seeing as the main challenges to the sharing of health data within the EU and beyond?
That's a wide topic, and I think I'm going to start by saying that today's purpose is health data only, so I'm going to focus on that only, because if I go to the rest, we're going to spend the rest of the day on it. I think, honestly, the regulatory framework by itself is a challenge because it's not been designed to facilitate exchange of data. Actually, on the contrary, it's been designed to protect data at all costs and under all circumstances, putting the individuals at the heart of, the whole protection system. Mm-hmm. And it's a good thing. let's be clear, I'm not saying it's not a good thing. I'm just saying that within the context of health data sharing, it shows its limits, because again, there are very little incentive, to share data, very little legal mechanisms to facilitate. We can always build something up, to allow sharing, but it's generally quite complex. It can create lots of constraints for the various parties. It can also have sometimes a significant impact on the usefulness, of the data that you're sharing, or the efficiency, of the processing that you can then carry out, because you're putting limits, you're putting conditions, or you're removing, a part of the data set which is considered as too sensitive, or maybe allowing too easily identification of the individuals, for example, so you want to make them anonymous or more likely pseudonymous. So all this, is a huge challenge. I'm thinking that, we have had a conception of data protection that is very, as I said, geared towards individuals. Should we sometimes think more about society, or a word that French people hate, communities, rather than the individual? Should we put that, like, the greater good before the interest of each single individual, to facilitate, to a certain extent, and in the context of research, for example, and so on, the exchange of personal data, of course, ensuring security and so on, but plan for legal mechanisms which make it easier for people who want to work together to actually share the data. And the second huge problem is trust, because I think that these legal mechanisms will be really efficient only if all parties trust in them, trust in the use that is made of their data, trust in the importance to share such data, to move forward, research and everything. And trust means that everybody understands what's going on, basically, what is health data, who needs it, for what purpose, how are they going to use it, what type of protection are they going to put, around them, and so on. And again, here, I think we are a little bit behind, definitely in France, but generally to the EU, with some differences from one country to the next. But globally, we still have quite a little way to go to reach full trust.
Next question we have is for Maya, and it's actually from Sarah Cameron of Pinsent Masons. Sarah, I wonder if you'd like to put your question directly to Maya.
Hi, thanks so much, Clive. Really interesting discussion. Maya, I could listen to you talk for hours. I had a question about privacy enhancing technologies and just how sophisticated and mature you think these are, and what is the most effective one for use with health data at the moment?
This is a really good question, and it covers such a wide area, and it's sort of, I think Annabella touched on many areas on this. I think, I think that you can never protect everything, because you need people to access that data. You can obfuscate and pseudonymize the data, but I think, then there's ways of tracking it back. So you're just raising the bar constantly. But I think you're trying to raise the bar to stop as many people as possible getting to that data. And then you're balancing that with the actual value of that data set. Data sets are often difficult to get hold of, but you're trying to get hold of rich data sets without losing the parameters in there. And you're trying to not add bias when you're selecting on those parameters. So it is a really good question, because you need to protect the data, but you also want to protect the algorithm, but you also want to have that openness to be able to share. There is some pretty good progress in this area. One of my areas actually of interest is cryptography and using algorithms to hack some of our latest encryption techniques. So, again, there is a certain level of robustness on that. And also we've got sort of a level of quantum security as well, which is for the future. So looking at that. So I think as techniques improve within computing, that will also put us at risk as well. And if you've got the health of the nation in that, and we do have a lot of exposure of data. I mean, if you've only looked at something like your smart meters, for instance, your smart meters show a pattern of how you use your electricity during the day, but that also shows what you do at night and whether you've got insomnia when you turn on your TV. So you've got exposure of a signal there of switching on your TV or kettle, or whether you just switch on the light just to go to the bathroom and go back to bed. And that shows your health as a nation. So we do expose in many different angles. It just depends on the creativity of the hacker, I guess, or those that want to get the data. So maybe I should be quiet.
Thanks for that, Maya, and thanks for the question, Sarah. I have another question for Annabelle now, a question that's come in from chat from McKenna Roberts. McKenna asks you, Annabelle, where are we? Do you see the proposed European Health Data Space Regulation and its interaction with the proposed Data Act and Data Governance Act as the useful clarification you seek in European governance?
Let's say it's a good start. Yes, I mean it's a very positive sign. However, for this, or on this topic, like on others, I don't think this type of European initiative is the answer to everything, that it's going to solve, all the problems that we have. But it's definitely a good sign, in terms of even just the realization, at European level that we needed this type of initiative. The necessarily discussion that it's going to start between member states, and between the various stakeholders and so on. And generally, I think, there are always positive things coming out of this type of improvements, because we know that it's from these discussions that are going to be created, within this space, that maybe we have the seeds, for the next key regulation or key markers, for our evolution, again, in this space. So yeah, I mean, it's still very new, so we can be extremely optimistic. Let's hope that it's not just a series of committee and commissions which are losing themselves in themselves, and that they're focused on pragmatism, and efficiencies, because the purpose is not, in my opinion, to make more regulation. We have tons of them already, which are particularly difficult to coordinate, and live with each other. So what we need now is some pragmatic, some very operational mechanisms that are helping all the stakeholders, go to the next stage, get one step up, basically, in the development of the use of data set, the protection of individuals and of data, but at the same time, development of AI, in all kind of sectors and subjects.
Maya, I can see you frantically nodding in agreement there. What are your thoughts on this topic?
No, I think Annabelle's sort of covering it all, and I'm certainly in agreement with her on that. And yeah, I think, it does ring so many bells of truth there with what she's saying. So yeah, and I'm right behind her on that.
Maya, do you think the complexity of the ecosystem we're dealing with here adds to the challenge in the health sector?
Yeah, I think so. It almost comes down to the psychology as well of the individuals involved, as how they approach it. AI is a tool to be used, but when you talk to the experts, they're at often different levels. I mean, I was using an algorithm the other day from the 1960s, which was appropriate to what I was doing. But then, there's more appropriate stuff from 2012. So I guess I think the capability within the teams is often important. It's also you come at it from many disciplines. I mean, my original background was in anatomy and physiology before I went into computer science. And when I was in anatomy and physiology from the biological sciences, you came at things with statistics. But when you come at machine learning from a computer science background, you're coming at it with probability. So you've got these instant clashes occurring in the way you think through, the development of these systems. One of them is quite creative about domain specific. One of them is about building robustness within that system itself. And I think some of the classical software engineering techniques are being kind of left out. So I'm seeing people prototyping in Python, which is a fantastic language to prototype in, but they're not being able to scale. So they can't put it onto distributed systems because they're programming in what we call object-oriented programming, which is very good for humans to understand, whereas they should probably be moving into something like functional programming. So, I mean, that's a very technical sort of area, but it's a different paradigm of how you think and how you process. So I think the tools and the excitement there for people getting into it are often coming in with those more of a hobbyist skill sometimes there, rather than coming with the deeper understanding, and that can lead to complications later on about how you can process. And I think Annabelle sort of also alluded to this. Also, it's not just about releasing that system, but sometimes that system also has a time factor on it. I mean, if you were to look at something that was making a decision on a respirator, should I turn this respirator off, or should I alter the way it's working with a patient? If it was an automated system, you don't want it to think about that over the next week. You need it to do it pretty quickly. So the development processes, I guess, for how you train and you have the people to understand and build those systems is equally important.
Annabelle, do you have any thoughts on that matter of complexity? Is the complexity of the ecosystem adding to the challenge that the health sector faces on this?
Of course. I mean, it raises first a question of trust. The more complex the ecosystem, the harder it is to understand, even sometimes for member of this ecosystem, who themselves have doubts about, who's doing what, who's responsible for what, and so on and so on. But of course, even more for people looking from the outside, so understanding, again, the roles and responsibilities of the various stakeholders. And particularly in our current context, when we see these roles and responsibilities, as I was saying earlier, evolve very quickly, and being impacted significantly by the evolution of technology, that is being used by the various stakeholders again. So yes, the complexity is by itself a challenge and definitely not helping the topic.
I've got a question here that I'd like to maybe put to both of you. Should the roles of different stakeholders in collecting and processing personal data be addressed to make a step change here?
I would say yes. I think there's definitely some education to be taken there. If we look at past experiences of people working through data sets, I think sometimes the claims of what they would like those data sets to provide. I think the actual collection and formation of those data sets. I think also teaching the people who are maybe cleaning up those data sets as well, not to clean them up too rigorously because we could lose information in them as well. So yeah, I think certainly there's a lot of work to be done in training people into these areas on how to work with data and how to process it without adding bias into it. I think we also have to be cognizant of our end user set. If we're using something that is to process data on a socioeconomic group or a social group, which is one particular sort of domain, we need to make sure it covers the whole of that domain, not missing anyone in that group. And that's something that sometimes gets missed out and then can lead to complexities later on, certainly in research. If you're trying to make decisions on the whole of the group, but then you're not actually assimilating data on, or you're assimilating data on just a subset, you're not going to actually get that information you need. And that has held up certain research in the past. And certainly that not only impacts things like data science, but it obviously gets extrapolated into machine learning on larger scales.
Annabelle, any closing thoughts from you on that particular topic around the roles of different stakeholders?
I fully agree with Maya. I think that's an important point. I also think that we need to take into consideration that these roles and responsibilities need to evolve very quickly, to be able to evolve very quickly, because the technology itself, the way we're processing data, the purpose for which we're processing it, and how to fight the bias, for example, things like that are evolving very quickly. And so we need to adapt the roles, the responsibilities, the training, of course, and the awareness of the various people which are involved at the various stages, of data processing. So yes, it needs to be addressed. not in regulation, of course, because of this need to quickly evolve and follow the reality of the use, and reality of the technology.
Wonderful. Thank you so much, both of you, for this extended time we've spent together to really sort of dig a little deeper into the things you've shared with us today. And you have shared a lot. So for everybody listening here, we will be circulating materials relating to our time together this afternoon, so you can continue to read, to digest, whether it's the slide presentations, whether it's Lara's presentation from earlier, Lara's interview rather, Lara from the Ada Lovelace Institute. We'll be sharing lots so you can digest it at your leisure.